great advice. What's the future hold? You say you're 83. You look fit and
Well,
vibrant and well. What do you got plans?
Pick your parents. That's well, my wife just retired, so we're involved in all sorts of other things. You don't get bored. So we have plenty of things to do. And I was lucky enough during my career, like a lot of people, that I traveled a lot during the career. My wife traveled too. So we're not hot on traveling when we retire. So we're content to go to the shore in the summer and stay here in the Brookline, Boston area in the wintertime. And but I've always had hobbies. I've always sailed a lot, always skied a lot when the kids were growing up. I look back, and early in my career at the clinic, every other weekend we'd leave Friday night, go skiing, come back Sunday night, pooped, and go to work Monday morning. And I look back now, I said, God, how could you ever do all that? And of course, if you're going to do academic stuff, that gets done on nights and weekends. If you're an active clinician, you don't do it during the daytime because you don't have any time. So it's all, and it's not easy to do for people with family pressures and kids to take care of and stuff like that. So I think it's harder now than it was when I was coming along.
Having said that, it doesn't sound like it was a job for you. It was a passion. It was a joy. It was fun.
Yeah, it was fun. It was fun. There's a certain amount of boredom to any job you do, but unless you're really engaged in terms of some of the academic aspects and the biology of the disease and things like that, that keeps you going. But to get into a job where you're just cranking out cases all day long and not doing something else didn't ever appeal to me. And one of the things about the Mayo Clinic that I heard was that, Ollie Beers, from what I understood, used to run 4 or 5 rooms.
Yeah.
And the fellows and residents would open and close. And I never wanted that kind of practice. I wanted a practice where I was involved with the patients and saw them beforehand and operated on them, took care of them, and saw them back in the office and stuff. So I didn't want to do that kind of practice. I wanted to stay involved clinically with what was going on. One of the treats, and as you know at the clinics, is we used to have our own scrub nurse. I had my own scrub nurse for 10 years. And people now can't imagine the efficiency that creates. You don't have to ask for anything. There's no talking in the operating room. You just hold your hand out. And Kathy used to know what I was supposed to be doing. And the resident sometimes would say, give me such and such a clamp, and they'd be given something different. And the nurses would say, that's what you're supposed to have at this particular time. I don't know whether that's still true at Mayo or not.
We try to keep the same people, but you're right. It's more of a problem. It's 9 o'clock. It's break time, and now somebody goes.
Yeah, and I'm sure it was true at Mayo Clinic. And my nurse saw every patient in the office with me, saw every patient in the operating room, and the patients would go into the operating room awake, and they'd see Kathy, and it was, and then she'd see him in the office afterwards, and it was a tremendously efficient way of practicing surgery, and helped make it fun rather than just a technical maneuver. Yeah.